Pollen allergy. Every spring, millions of people start sneezing before they even step outside. Pollen allergy, often called hay fever, happens when the immune system treats tiny particles from trees, grasses, or weeds as a threat. The body releases chemicals like histamine to fight something that is completely harmless, and that reaction causes the sneezing, runny nose, watery eyes, and itchy throat that so many people dread each season. The amount of pollen in the air changes by season and location, which is why some people only suffer for a few weeks a year, while others feel it for months. Food allergy. Food allergy is one of the most serious and common allergies in the world. It happens when the immune system mistakenly identifies a food protein as dangerous. The most common triggers are peanuts, tree nuts, milk, eggs, wheat, soy, fish, and shellfish. Symptoms can range from mild itching and hives to severe swelling of the throat, making it hard to breathe. In extreme cases, it can lead to anaphylaxis, which is a life-threatening reaction that requires immediate treatment with epinephrine. Unlike food intolerances, which cause digestive discomfort, true food allergies involve the immune system directly. Dust mite allergy. Dust mite allergy does not come from dust itself, but from microscopic creatures that live inside it. These tiny organisms thrive in warm, humid environments and are found in mattresses, pillows, carpets, and upholstered furniture. When a person inhales particles from dust mites or their waste, the immune system can overreact, producing symptoms very similar to pollen allergy: sneezing, congestion, itchy eyes, and in some people, worsening asthma. Because dust mites are present year-round indoors, this allergy tends to cause persistent symptoms rather than seasonal flares. Pet allergy. Pet allergy is commonly misunderstood. Most people assume they are reacting to animal fur, but the real trigger is a protein found in pet saliva, urine, and skin flakes known as dander. When a cat grooms itself, for example, that protein coats its fur and eventually becomes airborne. Dogs, cats, rabbits, and rodents are all common sources. Symptoms include sneezing, nasal congestion, itchy skin, and red eyes. For people with asthma, exposure to pets can also trigger breathing difficulties. The tricky part is that dander can linger in a home for months even after a pet has been removed. Insect sting allergy. Insect sting allergy can turn an ordinary outdoor moment into a medical emergency. Most people experience normal pain and swelling when stung by a bee or wasp. But for those with this allergy, the immune response goes much further. The body floods itself with chemicals that cause widespread hives, dizziness, swelling of the face or throat, a drop in blood pressure, and in severe cases, anaphylactic shock. Bee stings are the most common cause, though wasps, hornets, and fire ants are also frequent triggers. People with known severe reactions are usually advised to carry an epinephrine auto-injector at all times. Mold allergy. Mold allergy is triggered by tiny fungal spores that float through the air, both indoors and outdoors. Outdoors, mold grows on decaying leaves, soil, and rotting wood. Indoors, it tends to develop in damp areas like bathrooms, basements, and kitchens. When a sensitive person inhales these spores, the immune system reacts with sneezing, nasal congestion, coughing, and sometimes itchy or watery eyes. Symptoms often worsen in humid weather or in spaces with poor ventilation. Unlike pollen, mold spores can be present at high levels almost any time of year depending on the climate, making this allergy difficult to manage seasonally. Latex allergy. Latex allergy is a reaction to natural rubber latex, a material derived from the sap of rubber trees. It is found in gloves, balloons, rubber bands, certain medical and dental equipment, and many everyday products. People who are frequently exposed to latex, such as healthcare workers, tend to develop this allergy more often. Reactions range from skin redness, itching, and hives at the point of contact, to more serious symptoms like difficulty breathing and anaphylaxis in severe cases. One notable aspect of latex allergy is its link to certain foods. People with this allergy are sometimes also reactive to bananas, avocados, kiwis, and chestnuts due to similar proteins. Drug allergy. Drug allergy occurs when the immune system reacts to a medication as if it were harmful. The most well-known example is penicillin, which is one of the most commonly reported drug allergies in the world. Symptoms can include skin rashes, hives, fever, swelling, and in serious cases, anaphylaxis. It is worth noting that true drug allergy is different from a side effect. Side effects are predictable responses that can happen to anyone, while an allergic reaction specifically involves the immune system. Drug allergies can sometimes appear after a person has used the same medication safely for years, which makes them particularly unpredictable and important to report to medical professionals immediately.